The nurse in the emergency department assesses a client diagnosed with burns. Which observation most concerns the nurse? A. Redness and swelling with fluid-filled vesicles noted on right arm. B. Charred, waxy, white appearance of skin on the left leg. C. Reddened, blotchy, painful areas noted on the trunk. D. Blistering and blanching of the skin noted on the back. Answer: B. Charred, waxy, white appearance of skin on the left leg. Rationale: this describes a full-thickness burn. All the skin is destroyed, and the muscle and bone may be involved. The substance that remains is called eschar and is dry to the touch. Full-thickness burns do not heal spontaneously and require grafting. All functions of the skin are lost. Rationale for incorrect answers. A. This describes a partial thickness burn. Only part of the skin is damaged or destroyed. Large, thick-walled blisters develop, and the underlying tissue is deep red and appears wet and shiny. The damaged skin is painful with increased sensitivity to heat. Healing occurs by evolution of undamaged basal cells and takes about 21 to 22 days. C. This describes a superficial burn. The skin appears pink and has increased sensitivity to heat. Healing occurs without treatment. D. This describes a partial thickness burn. 2. The nurse providing care for clients with diabetes mellitus receives report. Which client does the nurse see first? A. A female client who reports urinary frequency and burning with urination. B. A client with a BP of 90-60 mm Reddened and whose skin is hot and dry to touch. C. A client with a BP of 120-50 mm Reddened and who reports frequent urination and thirst. D. A client who reports experiencing constant hunger. Answer B. A client with a BP of 90-60 mm Reddened and whose skin is hot and dry to touch. Rationale: the lower blood pressure and hot, dry skin indicate dehydration caused by hyperglycemia. This is the first stage of diabetic ketoacidosis, DKA. This client has a circulatory concern and is the highest priority. 3. The hospital has just received word that a major disaster has occurred and a large influx of clients is expected in less than 1 hour. The nurse considers which current client is best for immediate discharge. A. An older adult client, admitted 4 days ago with a diagnosis of a stage 3 pressure injury. B. An older adult client admitted 12 hours ago with a diagnosis of pyelonephritis. C. An older adult client 3 days postoperative after a total hip replacement. D. An adult client 24 hours postoperative after a vaginal hysterectomy. Answer: C. An older adult client 3 days postoperative after a total hip replacement. Rationale: this is the most stable client. Clients post-total hip replacement are typically discharged on postoperative day 2 to 3 to a rehab facility or home.